This is a public service announcement. My name is Dave Rafuse, owner of Blended Athletics. It is almost September. The kids are going back to school. It's going to be dark before we leave work soon, and many of us have had too many barbecues with burgers and beers. It is time to get back into shape, and Blended Athletics is here to help. Blended Athletics has had a lot of world-class athletes come through the doors in the 3 years we have been open. We have also had some incredible transformations where people who have been inactive for years have gotten their butts off the couch and have completely flipped their life upside down in the most positive way. The question I still hear from people when they ask me, why Blended Athletics when there are dozens of other gyms in Halifax? And those three reasons include: 1. Blended Athletics is a facility that's different than any facility in Halifax. We are truly a training facility. We're the real deal. Unlike many commercial gyms, which say they're there to help, but really are just designed to churn members through. My question is, if commercial gyms are there to help, why do you go onto Kijiji and see so many people selling their memberships that they have been locked into for years? Blended Athletics is also filled with people that want to find their personal best. If it's an athlete, an executive, or a full-time mom, it doesn't matter. They're all here to work hard, push their limits, and get better every day. Number 3, Blended Athletics treats members as valued patrons, and we know we have a responsibility to give our members our best in service, our best in program design, our best in coaching, as well as the value and enthusiasm that they deserve. The reality is that we are more expensive than most gyms, but we're the best. We'll continue to push the envelope to be the best, and as a result, if you walk through our doors and give us 100% effort day in and day out, we will ensure that you become the best you that you have ever been. If you live anywhere in the vicinity of Halifax, your life can be changed by seeing just 2 men in this city. Myself, as a CrossFit coach, I will show you that hard work takes time. I can also tell when you're lying. The second person is Dr. Warren Hefford, who I'm sure many of you already know. So to introduce Warren, I decided to take a little road trip, and earlier this week, I visited him over at Choice Chiropractic on Main Street. I'm going to see Dr. Warren Hefford. This is like the worst part, is walking into his office before the treatment because you know what's coming.
Hi everybody, my name is Warren Hefford. I'm a chiro here. I practice on Main Street in Dartmouth, as well as Halifax. I've been in practice for, I guess, into my 7th year now, focusing mainly on sport-specific injuries.
Do you find enjoyment in torturing people?
I love torturing. I get a bad rap, Dr. Pain. We hear that one a lot. For me, usually it's the outcome. So there are some blood, sweat, and tears in here, but at the end of the day, the outcomes are always worth it, I think.
Before we get started, I mean, you do this for me every time, but I'm a beast, right?
You are.
Yeah.
I would say the biggest beast that I
A little bit of motivation to make me tougher through this experience. So let's see where we can go with it.
We're going to start with a little bit what we call electroacupuncture, where we put a little stim to the needle, and essentially we're going to see some muscle activation. So here we're just stimming. This is basically the the common perineals, or the perineals, common fibular group. And as we can see, they evert the ankle. How you doing, buddy? Okay. This is actual treatment too, eh? It's good.
You told me I'm a machine.
This is called Graston technique, and it's pure torture. What it's really good at doing, so Graston is really good for fascial adhesion, kind of surface tension. And if you can picture the whole posterior shoulder complex here, we get a lot of muscles, a big confluence that come up and attach, and things get kind of wound and just tight in there. So Graston's really good at picking up and dealing with low-grade adhesion kind of at the surface level. So what we're going to do is we're going to get in and we're just going to give Dave a nice comb here as he actively moves, just to kind of help with that tissue. So I'm going to get you to pull across. And as you can see on the back here, we start to get a little discoloration, or what's called petechiae, and basically that's little bleeds into the scarring in the fascia. But it's really going to help open up this posterior shoulder complex. Reach all the way across, give it a pull with your other hand.
It feels like you're getting skin.
And it feels like you're getting skin. You can kind of see that nice, where we cleaned it along on that posterior shoulder complex, allowing him to move quite a bit freer through there. So, how's that?
Perfect.
Good?
Looks like I got a giant hickey from an octopus. But Warren, you're a good sport. I appreciate you letting me come in and take that video.
My pleasure.
And also appreciate you coming on to the show tonight. Remember guys, this is a live show. So if you have any comments or questions, throw them into the feed. We'll kind of keep track of it throughout the show and answer any questions that might pop up. To everyone tuning in, you are watching BlendedTV. Thank you for taking the time to join us tonight. The whole show is dedicated towards offering fitness advice and motivation. Our guest tonight is Dr. Warren Hefford. Originally from Newfoundland, he holds a Bachelor of Science degree from the University of Prince Edward Island. He's got an interest in sports medicine, which led him to the Canadian Memorial Chiropractic College in Toronto, where he graduated in 2010. Currently, he is completing a 2-year residency program in chiropractic sports sciences, as well as a Master's of Science in Kinesiology at Dalhousie University. He is a certified strength and conditioning specialist and specializes in active release techniques, contemporary medicine acupuncture, aka death, and you will also see him doing some Graston techniques, which you saw in that video, and that is absolute torture. He also has a beautiful wife, Amy, and now has 3 kids. Incredible.
Life is a
You are
long
a busy,
show.
busy
Yeah,
man.
busy times for sure.
So I'm gonna get right to the one question that I probably get asked more than anything else when I recommend people to go see you.
How much is it going to hurt?
No, that's not the question. People think a chiropractor, how is that gonna help me? Because the majority of the clients that I recommend to come see you, it's not spinal issues necessarily.
Yeah.
And I think most people, when they think of a chiropractor, their initial instinct is snap, crackle, pop.
For sure. Yeah.
Right?
Yeah.
And you're different. So unlike, and like, don't get me wrong, I've seen a lot of chiropractors over the years. I mean, I've been in the field. My university degree is in the field. Like, this is it, right?
You've been around the block.
I've been around the block,
Yeah.
and I've never met a chiropractor like you.
Well, I appreciate that. Thanks. I think it's good. Maybe, hopefully.
It's a good thing.
Yeah. You know, sometimes you hear the discussion between, you know, not a great term would be old school chiropractic versus more modern. But like any other profession, what we see is really we have a spectrum. You know what I mean? So on one end, we see, you know, chiropractors who are pretty much spinal practitioners, kind of like you mentioned, where they do a lot of spinal maintenance, spinal care, and that's the main modality within the treatment. On the other end is probably somewhere where I live, and it's not just me. I mean, there's other practitioners in the city that do a great job. But essentially for me, especially dealing with a lot of sport-related injuries, we bring into play a lot of functional work. So if, you know, we're looking at soft tissue, you know, we watch people move, we screen people, and then we apply the appropriate modality to kind of get them to that optimal level. And so as you saw in the video, we do a lot of something called active release technique, where we shorten and lengthen tissue under tension to really help kind of clean, in layman's terms, tissue and help things move, you know, better with respect to one another when we look at different muscle groups. Graston technique, your favorite.
Oh man.
So essentially it's, you know, there's been some really good literature. It's a stainless steel instrument, and literally what we do is we add stress through, you know, ligamentous and tendinous fibers to really help strengthen and clean and help kind of heal those types of tissues.
I'm not joking. It looks like I took my shirt off earlier to show someone, and it's still like that was. I came in and saw you on Monday.
And I know, and a lot of, and just to speak to that, a lot of what we do is with fascia work, and as you know, fascia kind of connects our muscle groups together. We have some superficial fascia is often what's really tight, and so Graston, as you felt, even though it feels like we're kind of coming through, it is a very superficial technique, but can be a little bit uncomfortable, especially when we do it under load, which we do with you. You know, you're lifting something or you're doing something that's kind of helping to recruit the, you know, the neurological system. So, and then similarly needles. One of your other all-time favorites, you know, we do a lot with needles just to really address, once again, the nervous system. and just help with overall, increase of function for sure.
Yeah, I actually really enjoy dry needle.
Yeah, I know.
I mean, I think initially it's a little shock to the system.
Yeah, no, a lot of people get rattled at first, but
yeah,
I always do the same spiel, and people have heard me talk 100 times, but just get through, the day.
Yeah.
Stay moving, and that's the big thing. You just move the tissue,
and there's certainly areas that I dread more than others. Like my traps.
Yeah.
Like I find that's kind of enjoying, but when you get into my TFL or into like my adductors,
a lot of blood supply down there.
I really just want to hit you.
No, for sure. But that would be the main thing. Like I said, and it's not that traditional chiropractic isn't great. I mean, it's phenomenal if you look at acute neck pain, acute back pain. It's great, but when we deal with a lot of athletic injuries and athletes in general, different calibers, you just, we kind of try to take it to the next level, which is really treating functionally. So after the passive treatment that we just talked about, then another big thing is obviously we're going to follow it with appropriate rehab.
Yeah.
So it's all about the strength, the mobilization, just making sure that things are working the way they should. For sure. Yeah.
And you still do obviously a lot of adjusting.
Yeah, I do. Yeah, no, absolutely.
It's really just dependent on what
it's a case by case patient or basis. So I mean, if there's if we find after we clean out tissue and that there's a block or there's a resistance, if it's a mid back, we see a lot with overhead athletes, CrossFitters, people who throw things. Sometimes we get that kind of upper cross where we get quite a rigid T-spine, which really affects the way that the shoulder blade works and moves, and probably we'll talk about some shoulder pain stuff, but. So that's a good example where if we see that, we'll probably do a little bit of a mid upper thoracic mobilization just to help with that extension. But then importantly, follow up with appropriate drills and mobilization techniques that you can kind of do away from the clinic.
That's probably one of my favorite. My favorite things about you is that when I do send clients to see you, the first thing I ask when they come back is usually like,
how bad was it?
Yeah, how bad was that? Like, how much did that hurt?
Yeah.
They'll give me a good 5 minutes on telling me to basically
torturous.
Shove it.
Yeah.
But at the end of the day, the reality is that you've given them homework, and the next conversation I have is, okay, so like, what is your game plan over the next 2 weeks?
Yeah.
And I mean, one of the things I would say that is also different than what most people would perceive going to a regular chiropractor would be like, is that people don't see you as often as what they would see, what would you refer to, like, not the old school chiropractor, but someone who specializes
I would
in,
call
like,
it maybe
adjusting
traditional chiropractic. So it just depends. Some people like to do maintenance care, and that's great, so some chiros will do, like a once a month type of checkup, and to each their own. There's some benefit for sure. But once again, on the other end of the spectrum, kind of where I am, and like I said, some of my good colleagues, essentially we treat on an EB basis. So usually what I see is an acute type injury, then we treat as much as we need to kind of get them out the door. But the end game for us is always to kind of give people, if not fix, give people the ability to help fix themselves and move them on. We like to graduate people. Yeah, for sure.
So preventative healthcare is something that we talk about a lot at Blended Athletics. I mean, it's something that our entire program is kind of developed upon. Now, chiropractic is something that most benefit companies will. You can put a claim in and get it covered. But why do you think in Nova Scotia that I would say the majority of people do not take advantage of their benefits, and they do not use their full benefits plan? Like, they don't go to massage, they don't go to see their chiropractor. The reality is that they don't see their optometrist, they don't do anything.
And I think that speaks to the problem, really. I think really just people, not that there's ignorance, but people, it's the old saying, if it's not broke, or don't fix it. So I think, and we all have that mentality to a certain degree, that essentially, if you're feeling a little nag or something, it's always that same, let's wait it out, let's give it a week, let's give it 2 weeks, we'll do some mobility stuff and hopefully it'll go away. Well, oftentimes, the most common thing we see is a repetitive strain type injury where if there's something happening with the mechanics or the way someone's moving over time, it kind of escalates and becomes more problematic. So I think what happens is that people kind of wait and see, and then at the end of the day, there's that time lag where they don't actually get the appropriate care. But with respect to actually approaching practitioners, there's a little bit of a knowledge block as well. Like, not all the time do people know kind of where to go with certain elements. So I think physio is a little bit more savvy and well used, but
with respect to chiropractic specifically, I think there's that little bit of a knowledge, but we're doing, we do things like this to try and get out and educate people. But it is unfortunate because these repetitive strain stuff that eventually they walk in the door, it's almost to that point where it's so much harder to fix.
Yeah.
As opposed to if we get someone in a more acute phase of any type of injury, and we get, we start moving forward with the appropriate care, the appropriate drills, the appropriate rehab, usually it doesn't even become an issue, as opposed to someone coming in a year later with an acute subacromial or a chronic subacromial impingement or something going on with the shoulder.
We all know what that means.
We all know what that means, yeah.
No idea what it means.
Shoulder pain.
Shoulder pain?
Yeah,
there
yeah.
you go. Shoulder pain.
Yeah.
So, I mean, that's one of the purposes why we kind of developed BlendedTV was to educate Atlantic Canadians with experts, local experts within the field. Now, in saying that, because so many people don't use their benefits, I feel like the thing that we're lacking is educating them on why they need to be using their benefits. And we have every time I come see you, we have a lengthy conversation around this because I'm always constantly trying to learn.
Yeah.
I think the nice thing about kind of the field in Nova Scotia is that whether you're on the fitness side of things or you're more of a practitioner, we seem to do such a great job at working together to try to fix people's issues and ensure that people are kind of guided down the right direction.
Yeah.
And one of the things that I always struggled with initially was that I would get treatment until it felt better. I would do my rehab exercises until it felt better, and then I'd stop. Yeah. And the issue that we've talked about is that a month, 2 months after that, I would come back in with the exact same issue.
Yeah.
And that's something that we talked, like, it's neurological a little bit, like it's something that's going to continue to reoccur unless you stay on top of it for a pretty lengthy period of time, right?
Sure.
So like, how long should people be rehabbing from these injuries?
As long as it takes. And I mean, that's a great question. There's some different studies. One of the things that I try and tell people is when you feel like you're 100%, you do 4 more weeks. And that's kind of my guideline.
Yeah,
and
I like that.
Yeah. So usually you'll do another 4 weeks on top of being 100% functionally, strength, pain's gone, you're feeling great. And then with that being said, I've been around long enough that we see if it's, something going on with the knee because of weakness in the hip, or something going on with your shoulder because of weakness in your back muscles that stabilize and kind of keep you upright. As long as you're going to be in here lifting heavy weights, or if you're doing something that's putting a lot of demand on those structures, you always have to give some of those structures love. So it's not like you get feeling better and you stop. You should always implement, a certain amount of functional training into your training, auxiliary work, where you're working kind of the muscles that may become problematic again.
So when I talk to you guys in the gym about continuing your rehab, you just heard it from Warren himself. You got about 4 weeks after the point of you feeling great.
And then you still keep doing it.
And then you still keep doing it.
Yeah,
maybe even just cut back on the volume that you do it, but stay on top of it.
But you're always, if it's a hip, you should always be doing hip activation stuff before you do anything else. If you've got a history with shoulder, just get in and work on the scap stability stuff, scap mobility and stability. So you should always, it takes, you can get on the floor, you can, grab your crossover symmetry and you can get a lot done just by giving it, once a week. You take a little bit of time.
So on the discussion of injuries, it leads us to really what I want to talk about tonight, which is, and I don't want to segregate ourselves to like CrossFit side, but on the CrossFit side, I mean, we've got a lot of great CrossFit gyms in the city.
Yep.
You see a lot of different CrossFitters come through. What do you think is the most common injury that you see coming through your door? And, sorry, I'm going to change it. What do you think is the most common preventable injury that comes through your door? Something that, whether it's as coaches ourselves at each of our facilities or as individuals, that people, like, based on what they do on a day-to-day basis, because I mean the reality is that 95% of our clients spend their day seated, and knowing all of that, which is the problem. So like, what can people do in order to, well, what is the injury that you think is most common?
Well, I think
there
will probably be a toss-up, not to get into too much detail, mechanics and anatomy, but we see 2 things really commonly. One is shoulder pain. Shoulder pain is really, really prominent for sure when it comes to not only CrossFitters, athletes in general, people who work at desks, and it comes down to, we talk about something called upper cross syndrome, where really we start to round ourselves into our life. If it's the keyboard, if it's the mouse, whatever we're doing. And that's okay as long as we get out of that position and get back in and we continue to move. But what happens is when we end up loading the tissue in an adverse position all day, and then we come to the gym and then we're expecting to perform and be able to put weights overhead. So essentially with the most common shoulder injury would be what we just talked about, a subacromial impingement, but not to get too technical. There's a tendon that kind of lives under the bone here that's part of your shoulder blade. As we continue to round in internal rotation into what we're doing, we get a little bit of a bony impingement on one of your rotator cuff tendons. And it's one of those things that when we see these injuries, it's never, oh, there was a lift. That's very uncommon. It was like, I've got this shitty thing that's been developing over time, and it started off kind of on and off, and now it's becoming more prevalent on the day-to-day basis, pretty much everything I do. So that's the presentation. That's a repetitive strain injury. Over time, you get a little bit of micro tearing into the tendon, you get the chronic inflammation, and at that point, that's usually, we talked about the benefits. Yeah. That's when we see people, and then it's a lot harder, but usually that's what we see. So chronic shoulder impingements as a result of kind of what's happening with our scapula. Even we talked about our T-spine being kind of how I'm sitting right now, but I don't lift weights anymore.
I was wondering if you were judging my posture.
You were good. No, I told you you're straight. Yeah,
I'm actually really focused on that.
So like even that rounded upper back, so those are some of the things that kind of contribute. And once again, it's all about clearing function. You can treat the shoulder till the cows come home, but if you don't get in and kind of clear up the function that's causing, or dysfunction that's causing that impingement, we don't really get better. The other thing quickly would be the low back. We run into a lot of low backs, and specifically that is one where we'll have that single lift and it's the dead.
Yeah.
So we run into a lot of that. And I think the big misconception there is when we see people going in, not to get technical with lifting, but we get into the hole coming out of the lift, people are really concerned about the disc and rounding the back. And I think what actually happens if there's tightness in the hips, the hip flexors, we end up doing a lot of hyperextension. And that's really a more common fault, and just as we talked about upper cross, similar, there's on the lower end of the body, there's the lower cross syndrome where we get tight hip flexors, weakness in the glutes, tight into the hamstring, and we get that pelvic tilt.
Yeah.
And then basically when we start doing these lifts and we pop up through extension, then we start getting these hyperextension injuries. So I would say those are the two most common, and when it comes to prevention, they're very preventable. It's mechanics, and you guys do a great job of that, just knowing how to, but the big thing is mobility. If you want to put your shoulder overhead, you need to be able to get there by moving your shoulder as opposed to moving,
Yeah.
And there's many ways you can get from A to B. It's just the most optimal and how we kind of get there.
And the reality is most people have mobility issues.
Absolutely.
These are issues that
Everybody.
are happening before people are walking in the gym.
No, everybody gets mobility typically, some form of mobility. Yeah, for sure.
Yeah, mobility class, Monday, Wednesday nights, 8 p.m.
Check
with
it
Dale.
out.
You should be definitely attending those.
And the problem specifically with the shoulder is, we talk a lot about stability, scapular stability, pulling, pull. It's great, we have to do that, but the scaps also the shoulder blades also have to be mobile. So It's not just the big shoulder joint, it's also the ability to be able to move through the scapula, because as we go overhead, the scapula also has to track and move to allow us to get in that position.
So you mean stability in our end range of motion?
Exactly.
And so it's not just about the range of motion we have, but it's about
controlling it. Yeah, absolutely, controlling end range. But like I said, in order to get mobility and to get into certain, or you need mobility to have proper stability.
So what are some of your favorite recommendations from a mobility perspective for that upper cross syndrome?
So basically we talk, and we've been in here a little bit, but we love the extension stuff, the T-spine stuff. So grabbing a peanut, placing it on either side of the spine, really dropping the ribs.
Do we got a mobility pack?
My pants are way too tight. You're not going to make me get on the floor.
No, I'm not going to get you. But people aren't going to know what a peanut is unless
they
come to Blended Athletics,
sure,
right?
Sure.
So let's toss it over here.
That's a good one.
Give me a toss. So
that's a real good one. That's a peanut on steroids.
The two of us made these the day that you came into that lesson. Yeah. So all this is two softballs with the odor covering ripped off of it, and then just duct taped together. And
if you don't want to do arts and crafts, you can buy these, like Sport Check. All these department stores now have actual
this exact same thing on it.
But not
they're
like
easy to make.
That one's swollen.
Awesome.
It's swollen.
It really
is
good.
Big peanut. Yeah.
So something like this.
So putting that on either side of your spine, laying on your back, just really closing the window. We talk about closing the window between the lower ribs and the pelvis, just so that we're not getting leaky in that extension, and really keeping yourself stable and moving through the upper back. And so you can move, you know, segment per segment, you just check, you feel where you're restricted, and you really work on kind of getting into some of that extension.
So someone who has the issues that we're talking about right now, how often should they be
what I tell patients, I have a couple standard rules. A is that you mobilize and you do the stuff when you're warm. So after you've trained, after you've done something, that's when you get down. And really, you are going to get tender from this. You're going to get some delayed onset muscle soreness if you get in and work on the tissue. So you let things settle down, and then you go back at it.
So can you overdo it?
You can. Oh yeah, if you do this stuff every day, and you can actually get into some chronic shortening. But what I would say is that you allow the tissue to settle. And my rule is that if you get on the floor and it's a 10, if you're rolling a muscle, or if, you know what I mean?
Yeah.
When you get up, if it takes 5 minutes, 8 minutes, 20, 30 minutes, you need to get up and be at a 5, or you need to know that you've done something. Like, don't waste your time and get on the floor and just kind of lay on the ball, you know. Like, you have to make sure that it's productive for sure.
Yeah. And what about for lower cross syndrome? So
around
those hips.
Back with the shoulder as well. We talk a lot about, and you know this, being able to isolate rotation through the shoulder. So we do a lot of rotational moves, both internal and external. And the low back, exactly, you know, it's the hips, right? We know that the hips are always problematic. So we do a couple things, you know, some psoas, iliopsoas, or hip flexor mashing or mobility, as well as getting in and doing a lot of hip mobility. Because as we know, if the hips don't move, your back is going to take a beating for sure.
We do have a question here from Adam, and I tried to read through it, but I couldn't kind of look at it at the same time. He said, will Warren judge me for doing CrossFit, or give me suggestions on how to scale workouts to accommodate my injury? What movements to avoid?
Adam.
I mean, this is something that you do. So like when people come in and see you in clinic, that's one of the first things that you'll do is you'll have a discussion with them on kind of like what brought them into the office, why they're there to begin with, and then whether or not they should or should not be doing specific movements as they treat that. Which actually, I mean, not to jump away, because I think these two things tie in together. One of the things that I find many of your colleagues unfortunately recommend a lot of people to do is to avoid exercise. So they see people come in with injuries, whether it's in the gym, outside the gym. I hear it all the time, like workplace injuries, and the first thing they say is go see physio, but avoid working out. It's the last thing people ever hear from. Not that you never do it, but not very often do people come in and see you and you say you should stop working out.
Absolutely.
So why is your philosophy so different?
Well, I think what it comes down to is that when we see an athlete, we screen them and we know their limitations, right? And so for me, it's if you think about tissue tolerance, which is how much your tissue can tolerate and handle when it comes to training, when it comes to rehabbing, whatever it is that we're talking about, you want to stay at that tolerance. So if we draw a line and your tissue tolerance is here, and all of a sudden you just don't do anything, you're going to lose tolerance over time. You know what I mean? So what we want to try and do, and a general rule, it's the old sport medicine rule, you know, if it hurts, don't do it. Well, it kind of is like that. We try and keep people out of painful positions until they can own them and they're less painful. So if this is our tolerance, we want people kind of training right beneath. And how do we do that? Well, we screen, we get them to move. You guys do a lot of that in here. Like there's a little bit of trial and error, but basically we want people right at that tolerance rate so that the tolerance gets better. And then as we do the rehab, we do the tissue work, we get the mobility going, then the tolerance continues to improve. But if we don't move, or if we totally unload the tissue, and then our tolerance will definitely inevitably get less. And that's it's a longer process to kind of get back.
So you believe, even though like
keep moving, always.
It's just move
within your tolerance and move, and that's it. Own the motions. You have to make sure that if you're going to go into a certain space, that your joints can get you there, and your muscles, and in the optimal way. You know.
I mean, I truly believe that more often than not, inactivity is going to come with bigger and worse issues than some of the injuries that come from activity.
You see it all the time. Someone gets shut down and then something else starts to talk to them. You know what I mean? If it's all of a sudden my back is sore because I'm not, you know what I mean?
Well, everything's connected. So in one way or another, when you fix one thing, it usually leads to a compensation issue that you had somewhere else, which was basically a compensation issue because of that injury, which then you have to go on and treat. So often I find when people come up and they have an injury, especially when they first get active again, so they've been inactive for years and years and years, and they've lost the range of motion that they needed to be able to function properly. And then they have some sort of hip pain, which leads to some sort of knee pain, which leads to an
Absolutely.
ankle pain.
It's all the old song. It's all connected.
It's all connected.
Yeah, yeah.
You kind of got to work your way through that,
Yeah.
and
Yeah.
that can take months. But I mean, at the end of the day, if you don't work through that, you might as well just head back to the couch, which again is just going to kill you.
Like
anyway.
a good example, and this has been well known. Essentially, like a lot of our knee pain, especially repetitive strain knee pain, we talk about patellofemoral pain syndrome. Some of the issues that IT band insertional syndrome at the knee. A lot of these things, as we know now, it's a direct result of what's happening at your hip, and that's been around for a while, as well as a magnitude of other things. But and so the hip strength, the ability to control your knee in space when you're planting and landing and jumping, and that all comes from hip stability. And so oftentimes, if it's not the hip, it's the knee, and then if the knee is getting sloppy, then we start getting the bottom of the foot and the ankle, and so it's completely. Yeah, everything is connected.
And it's like the very first thing we touch on warm up is to basically people spend so much time in their day seated, whether it's in a car, at their desk, at home, eating. I mean, anything that it is. So, I mean, the first thing that we do when people come into the gym and we start warming up for our workout is we try to undo some of that damage that they've done throughout the day. In order to prevent obviously
your hockey guys come back.
They're the worst
at the end of the season, bent over.
Because I mean, they spend so much time in that hinge over position. I mean,
sure.
The reality is we could talk all night about different injuries. And my goal is to kind of get you back onto BlendedTV to talk about some more specific things. Tonight was just like a general introduction to discuss some of those things. But before we kind of end
college talk? No more college talk?
No more college talk for tonight. But I do have something fun that I want to run with you. We're going to go through a little rapid fire game.
I love it. Let's do it.
So I'm going to ask you a question, and you're just going to kind of say the first thing that comes to your mind. This has not been pre-prepped, so it's whatever comes up. I have no idea
what's coming down the hopper here.
You're a hockey fan.
I'm a hockey fan,
Montreal, Toronto, or Boston?
Oh, man. I grew up in small town New. It was either Montreal or Toronto, but my grandfather, my father, Toronto. And unfortunately, I inherited it. I'm trying to keep it away from my guy. The Leafs, for sure. Don't hold that against me.
I think our comments just blew up. There's a lot of people that just kind of signed off.
They're coming, as all the Leafs fans say.
From a fitness perspective, CrossFit, Olympic weightlifting, powerlifting, or bodybuilding?
It's all this, it's so... I like CrossFit. I mean, you're getting a little bit of everything. You know what I mean? For sure. Now, can I talk for a second?
Go for it.
It's just the wrap, and we talked about this CrossFit and the wrap. Like sometimes with some of the injuries, CrossFit with the appropriate mobility and the appropriate stability. Hands down. For sure.
So when done properly,
exactly,
it basically provides you
you're getting the best of everything. How's that for an answer?
That's good. Here's one for you. If you had to put money on who would win a fight between me and Pat Horseman, who would it be?
Ooh, this is tough. I can't answer that.
You have to answer.
I can't. Maybe if you guys can arm wrestle.
No.
I don't know. I can't. That's on.
Pat's watching.
I gotta pass on that one. We'll come back.
It'd
be a draw. You guys are both tough. Tough as nails.
It's the worst answer ever.
He's strong. You're fast. You're strong too. It'd be a good tilt. Yeah, I think it'd go to distance. How's that?
Pat will have to hash that out. Lastly, for all the ladies who love to come and see you, long walks on the beach or laying under the stars?
The beach. Heat, water, sun.
I like it.
Yeah,
absolutely. That's a good answer. Warren, I really appreciate you coming out.
Thanks
tonight.
for making me uncomfortable.
Yeah,
that was good.
That was the plan.
Perfect.
It was great to have you on. We'll have you on
My
again.
My pleasure. No, it's a blast.
And guys, don't forget, next Wednesday night, we're back live on BlendedTV. Stay classy, Halifax.
Hey guys, thanks for watching. BlendedTV has evolved a lot over the last 2 months, thanks to the help from Rapid Eye Video. Just like Blended Athletics itself, we strive to continue to offer the best service and education we can. Our goal is to provide more Atlantic Canadians with the education needed to live a healthy and fit life. Please help us by sharing our videos. Be sure to follow us on Facebook and YouTube to get all the information you need to live a successful, healthy life inside and outside the gym. Oh, and if you have any ideas on what we should put on the show next, be sure to message me at dave@blendedathletics.com. More great things are to come. We'll see you soon.